night I was on the phone to my daughter and she said, "Dad, you sound funny, you're not making any sense." I said, "I think I'm having a stroke." And it was just from her saying, "You're talking funny," and I couldn't pronounce words properly. And I sat at the bottom stairs, opened the door and let the ambulance man in. She said, "Put the phone down, Dad, I'll ring for an ambulance." And they brought me in here and I had quite a big stroke then.
Part of my role is working in the hospital. I meet stroke survivors and their families very soon after stroke in the hospital, and support them really through their journey through discharge and into the community.
I didn't know anything about stroke. I didn't know anything about
You know
stroke.
what it did to you and how it would probably leave you. So she got all the leaflets, didn't you?
Yeah.
And just said, you know, there's different types of strokes, and I had a bad one, so will it get better? Will it get better? Who knows? You know, because say I've come on in, it's not 6 months, yeah, from where I was. Yeah, you want that to, and people behind you telling you you're going to get better, you know, it lifts you. You don't want negativity telling you, well, you might be like that forever.
You're very pleased to have them home, but at the same time you're absolutely terrified that they're going to have another stroke or something when they get in the house.
Elizabeth was really frightened about how she was going to manage because Phil had been so poorly, and the responsibility she felt of being responsible for looking after him was really frightening for her. And to have somebody really alongside her with that journey, reassuring her and listening to her concerns, and also sort of signposting her to the help that she needed from other agencies with benefits and finances and care agencies and social services and occupational therapy. I think she found really beneficial, really, and that I think is a really important example of being able to follow somebody through from the hospital into the community, and how important that had been with somebody with specialist knowledge, really, because she was looking for support with information with somebody who knew the process and who could understand what was happening.
Well, I saw a notice on the board, and the nurses said that there was a meeting in here on a Monday afternoon, and I used to come on a Monday afternoon, and like Phil coming out of hospital and medication, and then I didn't know what to do with the banking because Phil had always done it, and I was really frightened when he was coming home, and she was very kind to me, and it's just reassurance, really, isn't it? And just because it is a frightening thing when somebody's had a stroke and you don't know what's going to happen or what to do.
Phil had a big stroke, and he's quite a young person, as you've seen, and it was devastating to both him and Elizabeth and the family, and he was really poorly to start with. He did have to spend some time on the intensive care unit.
But she's done everything to put us in the right place where we should go with everything, and if I need anything, where to get it from.
When patients first come in that have suffered a stroke, we give them what is called our patient handbook, and we make sure that they've written a letter for me from the Stroke Association that I slip in so that they know, even if they can't remember when they're here, when they go home, they've got the information, they've got the name, they've got the phone number of Jane, so they can get in touch, because quite often we find people don't have a problem when they're in hospital. It's once they get home and they suddenly think, now what do I do? Who do I contact? And I think that's probably where they are the most valuable, but only if they've sort of been made aware of it while they've been in here and can ask, you know, the immediate questions, and know then that if the person's going to contact them, who they are, they've seen a face, they know that there's somebody that's approachable.
When a stroke survivor comes into hospital, they are seen by different therapists depending on their needs and what's happened when they had a stroke, and this can be an occupational therapist or a physiotherapist or a speech and language therapist, and this can be very confusing for them really, and confusing for their families, and so my role really, I see, is sort of supporting them through this journey in hospital, which is very frightening as well for them, and being somebody that can sort of talk about their fears and what support they're getting, and really reassure them and giving them the information that they need, and also liaising with the other professionals to ensure that they are aware of any concerns that I encounter when I see them.
I remember when Jane and her team first appeared on the ward and they were introduced around, I thought, oh, this is interesting, I wonder what they'll do. And since then I've been just so pleasantly surprised. They've just become part of the team, they're so helpful to us and the patients and the relatives. It used to be that we had someone come in with a stroke, they became the centre of that universe in that family, and we're inputting into them, but at the same time as therapists and nurses and doctors, we're having to spend an awful lot of time treating the family as well, because they had something devastated, and they did get a little bit left out. They were the second thought down the line, and Jane's team have just pulled that together, and we know now that even if we don't have as much time for the families as we would like to have, someone's out there, they're getting in contact with them on the ward, they're carrying it through into community. Families themselves have more opportunity to express their feelings and thoughts and worries and concerns, because Jane and her team can take it away from the bedside, away from the hearing of the patient, into that person's own home where they're comfortable.
I wanted to highlight the importance of the stroke associations, and the contributions is invaluable. I can't begin to put in words. First of all, the information that the stroke association provides is really useful, because as a professionals, as well as guiding the families and patients themselves to go back and refer to the websites, and it's tons of information and is really great.
Because you don't always see the same doctor every time. Like, our doctor's been away, so we've had to see another doctor, but it's not the same, and you need somewhere to ring if you're in a panic about medication or something like that. You just need somebody that knows what's going on, really.
You could tell the patients about something and it's overloading information. They might not listen at that precise moment, and the maximum time we spend is maybe an hour a day. So whether they focus on therapist and is a physical element to it, or cognitive element, or emotional element, we haven't got enough time to give that. But we find is Jane, when she come in, she actually spent time with the patient's family, talking to them and listening to their problems, and sometimes come back to us and asking us, this is issues or this is areas they're really worried about, can you look into it?
The fact that Jane and her team are Stroke Association as well is just a massive part of it, because we get patients in that have heard of a stroke, they've no idea what a stroke is, but everybody knows what a Stroke Association is, and those relatives and patients know that Stroke Association is out there and it does positive stuff for stroke, and that it's specialised. It's not just another charity, it's somebody who knows and understands the challenges that they meet. So I suppose for us that's why it's so great that it's not generic, it is the Stroke Association, and that follows through for those people, I think, as well, after they leave hospital, that there's Stroke Association activity out in the community, and they can feel more a part of that because they've been drawn into it by Jane and the team.
Having been in previous employment where there hasn't been a specialist service that's been supporting the MDT, it has made a valuable difference to the way I work, and thinking about that I will know if I need additional support, I can go to Jane for that, as much as she can come to me for ask for my specialist opinion, and I know that she will do something constructive with that, whereas a generic person from a generic service might not understand where I'm coming from or exactly how to guide some of my recommendations.
Stroke Association is they specialise in stroke and focus on providing the support to stroke patients. I don't personally, from my experience and what I see is out there is lots of generic services they might be focusing on older population. Age UK, for example, is a blank, looking at lots of different things. They are not focusing on stroke. Being stroke is, the one of the third biggest disability caused, and it's not a specialist. I think it's important to have a stroke specialist knowledge.
They come to our MDT, so they know what may arise with discharges, they know who our complex discharges are, they are part of the team when it comes down to discussions about discharge, about any issues that we've got, be it just about money or anything else. They're aware of the information that we're giving to the patients, so they know what we've said. So they're not actually then, when they go into patients' home or speak to them over the phone, they're not saying different things or not being able to say anything because they don't know.
We really value the work that Jane brings to our team, as well as the rest of the Stroke Association. It is really hard, I think, for a lot of people that come through that have never had a stroke before or don't understand the implications of it, and I think it's been really useful to have somebody like Jane from the Stroke Association to share some of our knowledge base, to be able to reinforce some of the things that we talk about. Obviously in the medical world there's lots of terminology, lots of very many specific things, and some people obviously feel really reassured by a label, but it doesn't help if there's not the staff from our end to reinforce that and just spend that extra time with people to help it sink in. And we do really value the work that we do together, and Jane comes to our team meetings so that she understands our perspective, and we have that sort of mutual understanding and ability to have a conversation quite frankly about what's happening in order to give that person the best care that we can give them.
And the continuity from hospital to home, none of the other teams are able to do that. From physiotherapy perspective, we pass on to community physiotherapy or the assisted discharge stroke service team therapists or the outpatient therapists, but it's not the same person. I don't pop up in their house and say, is everything going okay? But that's the sort of thing the Stroke Association team on the ward do.
It's alright while they're in hospital and we're their support, but once they go back into their own environment, they do need that service, they need that support.
One contact point was a good thing, wasn't it?
Yes.
Because I had no end of OTs and physios come in on me, and then it came the ones. You'd never had somebody to talk to. That was alright, you look forward to her coming because you know she'd been before. The others, they come just the ones, and that was it, wasn't it?
I am privileged as well that I can follow people through into the community after they've discharged from hospital, and because that can also bring a new set of difficulties and problems and concerns that I can support with, and also I can support once they're home, and to have that continuity from the hospital through the discharge to home is really important, because we're actually the only service that I know that actually follows through all along that pathway, and to see a familiar face is really helpful, and I can see that when I speak to them or when they recognise me, it's they find it really helpful that they've met me and know what to expect from me and how I can support them, really.
We set up a talk and support group on a Monday afternoon because we felt although Jane could go around and introduce herself to people, it was something that we wanted to be more formalised, and also the healthcare support workers wanted to be involved. So what we said was that every Monday afternoon the room would be free for the talk and support group, that we wouldn't only have the Stroke Association here, we'd have the different strokes, young stroke survivors local Lincoln group here as well, so that people were able to drop in, they were able to, you know, have a drink, they could have a conversation as a group, or they could actually just a one-to-one if they felt that there was something that, you know, they just wanted to speak to in confidentiality, that there was that opportunity.
Promoting healthy lifestyle, looking at, you know, exercise, diet and smoking, and that's really important. I think that's what the stroke associations provide, and also the emotional and psychological support is not at all available by any other services.
I couldn't have done without her, because I used to ring you, didn't I, in a
Well,
panic.
even emotional support, wasn't it?
Yeah.
You know, and looking after somebody who can't move is terrible. Yeah.
It's a shock, and you need somebody there. When you can't, I mean, it's not the sort of questions you can ask of your relatives or anything. You just need somebody that knows, really. When you ring up and say, please help me.
Jane's badge says family and carer support liaison. She's a massive support to us staff on the ward as well, because we know that something that we thought maybe we weren't getting the time to do as well as we should, there's somebody there now doing that work.
For me, I think it's just about, I hope it carries on. I hope it is something that is recognised as being essential to stroke patients and the stroke service and the stroke pathway, and that it is something that is valuable and is not, because I know at first it was just for a certain amount of time, but I feel that although the Stroke Association has always been a valuable asset to us with the leaflets and booklets and things, being a person is a far more valuable thing to us, and I think, you know, it shows when the peer groups come round and we have our reviews, because a lot of the things that they want to see for patient experience come from being supported by the Stroke Association care support workers that we have.
We have patients admitted to us, and that's the person that we as the NHS are here to care for. We realise, as I hope any professional working in stroke realises, that with that patient comes the family and all that comes with that, and we do have to input into them as well. But you know, without this service, that would become a massive part of our workload as well. It would be back to us in its entirety, and the pressures that are in the acute system at the minute, there's just not enough time for the other disciplines to give the people what they need and what they're owed really from us. So the gap would be huge, the pressures would increase on the medical team, wider team staff massively. Yeah, we can't imagine life without Jane and her team now. So yeah.